Welcome to our August Public Health Modernization Together Toward Healthy Communities. We'll get started in a minute. Apologies for being a couple minutes late. Thanks for joining us. Let's give it another minute and let people join in. All right, we'll go ahead and get started. Hello again, everybody. My name is Ilana Kurtzig. I am the COVID-19 policy lead at the Public Health Division at OHA. I use she and her pronouns, and it's good to see everyone who has their faces up, and it's good to see everyone's name who has their name up. So welcome. We are going to take the next hour to talk about youth health. So last month, for those who joined, we had a presentation on the climate change and youth mental health report that OHA released a couple of months ago. So if you didn't join that one or haven't had a chance to look at the presentation, I recommend you pop onto the Public Health Modernization website and have a look at that. We can drop the link in the chat here in a second. And we'll continue on the youth health with a presentation from our adolescent health program today. So we are recording as a reminder. I think when you join, you probably saw that, but just want to remind everyone that we're recording. We will be sending out the slides and then also posting the recording on the Public Health Modernization website. Also a reminder that we have captioning both English to English and English to Spanish. You can, the English to English captioning, you can enable directly from Zoom or click on the link, and the English to Spanish captioning, we've posted a link in the chat, and we can continue to post that as people continue to join. So let us know if you have any trouble accessing those. All right. We have values and principles by which we do this work. We acknowledge there are institutional, systemic, and structural barriers that perpetuate inequity that have silenced the voices of communities over time. We are committed to partnerships, co-creation, and co-ownership of solutions with communities disproportionately affected by health issues so that groups can actively participate in planning, implementing, and evaluating efforts to address the COVID-19 response and other health issues. We recognize community-engaged health improvement is a long-term and dynamic process. We are striving to engage with communities through deliberate, structured, emerging, and best practice processes. We are striving to make engagement with public health effective for communities, especially those communities that experience institutional, systemic, and structural barriers. And with that, just a reminder, as always, that OHA has a 10-year goal, a 2020 to 2030 goal to eliminate health inequities by 2030. So this is something that is in the minds of OHA staff as we continue to do this work. So with that, our agenda today, again, is to hear about youth health and particularly the Youth Advisory Council from the Adolescent and School Health Unit at OHA. We will do breakout rooms as we do each month. And as always, questions in the chat, questions not in the chat with, out loud, however you want to do questions is great. We are pretty informal, so if you have a question kind of in the middle, feel free to jump up and raise your hand or just jump in. So with that, I will pass it to Lev. Thanks so much for joining us.
Yeah. Hi, everyone. That's me and my dog. I'm Lev Schneiderman. I use they, them pronouns. I am a mid-30s white genderqueer person with short hair, and I'm wearing a pink button-up and some pink glasses. I am the COVID-19 School Health Recovery Program Coordinator. It's a mouthful, and if you have a shorter way to say that, I'm taking requests. And I'm part of the Adolescent and School Health Unit. And you can go to the next slide. So I was told that a lot of these meetings are about understanding more about the public health division, and it is very large. And so I thought I would sort of locate us. So the Adolescent and School Health Unit is part of the Adolescent Genetic and Reproductive Health Section, which is part of the Center for Prevention and Health Promotion. So public health is pretty big. We are a small unit in this institution. You can go to the next slide. So what does the Adolescent and School Health Team do? You can break up our work into pretty much 4 different sections. We do policy and assessment, and policy and assessment is kind of an overarching one too, because we do that with the other topics that are below. We also focus on school-based health centers. So we create the standards, and we provide some funding for the folks who are certified and technical assistants. Also similarly in the school nursing field, and we focus on youth sexual health. And you can go to the next slide. So how do we do our work? Our unit's vision is that Oregon is the very best place for all youth to learn, grow, and thrive. That's our hope for the future. And how we do this is to support the health of all youth in Oregon through evidence-based and data-driven policies, practices, and programs. And I would say more and more also through community and youth informed, and hopefully like co-created as we move to the future. And that is based in our foundational priorities. And 2 of them that I'm going to talk about today are youth engagement and health equity. So you can go to the next. So why are we focusing on youth engagement? And, I think as I do this work more and more in the Oregon Health Authority, I find this question more and more important, because there's this idea that, yes, it's important to involve community and youth in services and programs that impact them. But then when you really ask why, understanding people's why actually really informs how they do the work. And so I think it is always very important to ask why people want to engage youth. And so our unit, when we asked our unit and as we were doing this work, we value collaboration and partnership with youth. Hold on, something is in the way. To lead and guide policy and program development, we aim to empower and cultivate youth leadership to incorporate and encourage authentic youth voice and to promote health equity with and for youth facing the greatest barriers. So ASH believes, and that's Adolescent and School Health, believes that youth-centered decision-making will make for the best outcomes for youth in schools. So I think that nugget of information is really where the gem is that we believe that if we involve youth in decision-making in program and policy and services that impact them, that our outcomes for youth will be better. And outcomes in public health is also sort of a big word that can mean a lot of things. And so also our outcomes want to be informed by youth. And you can go to the next slide. So what we're trying to do with a youth advisory council, and I'm going to talk about specifically ways that we're engaging youth in the Adolescent and School Health Unit right now. And part of my job is standing up a youth advisory council, and I'm going to tell you more about how that's looking like, what that's looking like. But what we are trying to do with it is elevate youth voice by centering their vision in a youth majority space. In my previous position at OHA, I did a lot of work with youth in adult majority spaces, and I have found that youth majority spaces have been far more fruitful. Hold on one moment, I'm just going to close the door. And we want to build equitable representation in decision making. And we want to set a course for school recovery in Oregon that's informed by youth. And this money and funding that specifically for our Youth Advisory Council is COVID recovery funds. So that's why we're talking about school recovery. And then you can go to the next slide. And how we are setting this Youth Advisory Council up for success. This is really important because I have seen some less successful attempts at engaging youth in OHA, just because the infrastructure wasn't there or the funding. So one big thing is we're giving youth power to make tangible change by providing a substantial budget. So the youth and the Youth Advisory Council will get to decide how $1 million of COVID recovery funds is spent. We are also partnering with REAP Inc., which is a community-based organization, to facilitate the council meetings. We felt like it was really important to have an outside facilitator who main work is to help youth understand the policy and leadership world to make the best decisions that they can. And that has been an amazing partnership. I always say that the more I work for the government, the more boring I get. And so it's nice to have someone who maybe hasn't worked for the government for that long. We also are paying $45 an hour. And honestly, I think that's why we got over 300 applicants, because it's a good, I think realizing that these youth are consultants, and so they should be paid as consultants for their time. Another really cool part of our Youth Advisory Council, maybe the one I feel most excited about in some ways, is we're connecting youth to both statewide policy work, but we're also connecting youth to local community-based organizations through mentoring and information gathering. So 12 CBOs are being funded to support the YAC, and some of them are, I'm sorry, there's a dog barking. That is very unfortunate, but she's very cute. Good thing. So some CBOs we're just paying them to do their own youth engagement and come back to the YAC and present, like, this is how we are engaging youth in our community and this is what we're hearing. Or maybe the youth in their community come back paid through the community-based organization. And then some of the community-based organizations are actually mentoring the youth on the YAC in other ways in their life so that they can show up to the meetings in the fullest way possible. And then throughout the year, we're doing trainings on different funding models, ways to think about and find data. That was our last presentation in our meeting. That was on Tuesday. We're doing facilitation and other leadership skills. And you can go to the next slide. So what the YAC looks like right now, there's 20 students from across the state. We had 299 applicants, I think, and it was very hard to choose. We didn't expect to get that many applicants. 50% are from rural zip codes. About 25% were previously connected to community-based organization, and we thought that would be great so that there could already be a existing relationship to continue to bring community-based organizations in and create this network of support. All the young folks that are part of the council identify as being part of a group that was disproportionately impacted by COVID-19. And that could mean many different things, but with a focus on youth who are part of the LGBTQIA2S plus community, folks with chronic illnesses, folks with disabilities, youth of color, youth from farm worker communities. So we really tried to get a lot of experiences in the group, and making a decision with 20 people, whoever they are, is challenging. And then we have folks from all over the state, so it's been a really interesting and wonderful process so far to see people talking about how to share their really different experiences and then make a decision from that. And you can go to the next slide. So I also wanted to talk about thinking about different models to engage youth in our unit, because the Youth Advisory Council, I mean, I love my job, and it has been, it's such an amazing experience, I think, for the youth and for our unit to have this feedback. And I hope that we are able to continue this every year. I think that it's going to be like a really essential part of our unit. And I think that there are lots of different ways to engage youth, especially there's lots of different factors like our funding. We got COVID funding and that's what allowed us to have this extra batch of funds to fund the Youth Advisory Council. That funding is not always available. And so I think keeping funding in mind, or we have the ability to say $1 million can be decided on by the youth, but sometimes the decision-making power isn't as, it's harder to differentiate. And so thinking about, is it more appropriate to have a feedback session or in a listening session, or is it more appropriate to fund community-based organizations that are already working with youth to engage youth leaders and bring back the information? We're really trying to create policies and procedures for the Oregon Health Authority to think about ways to engage youth and center youth voice. And it's not always picking 20 youth to make a decision. It could be the student health survey, which surveys youth all over the state. And so that's one of our goals, is to help units think through what their resources are and what agency they have in some of the decision making, and then create a action plan based on those factors. And you can go to the next slide. So where we want to go from here, we would like to support and fund more community-based organizations to do their own youth engagement work. It's just organizations that are working directly with youth have a much better pulse on what youth are thinking and have relationships. And so it would be great to just fund organizations already doing this work or who are interested in doing this work to continue to do this work. I don't think it necessarily has to be at the state. We would also, as I was saying, like to create more policies for public health that guide this work. So there's consistency and accountability, like how much do you pay youth? And what is the process for choosing who gets to be on a council and how do you prioritize? So I think that there are so many learnings and just procedures and processes that we would like to create more of, like resources for other public health units or local public health agencies. And then this is very important to me, that all of these processes for engaging youth can be adapted to changing needs. What youth are experiencing, I mean, especially during COVID, things change for youth a lot, and the government doesn't change very fast. And so finding ways to create these processes that also can be very adaptive is really important to me. And I think important when working with youth, that every year we can hear from youth and there's ways to change the services and and what we're providing to better fit what we're hearing. You can go to the next slide. So these are some thoughts that I had, or questions that I had that I thought could be interesting to discuss in small groups are, in what ways do you see youth engagement supporting your work? So that goes back to the first question of why you want to engage youth. And do you think that your work is there buy-in for engaging youth, and what would you need? And that leads into the next question, or what are ways that OHA can support you, whatever, if you're an LPHA or a CBO or a unit in OHA, to engage youth. And some ideas I put down are, would you like grants, more trainings on youth adult partnerships, collaborative learnings for CBOs that are already doing this work. So we would love to hear from you.
Yeah, thanks, Lev. Before we go into breakout groups, which we'll do for at least 15 minutes or so, I just wanted to see if anyone had any questions or thoughts immediately, which you can drop in the chat again or just unmute and go for it.
Hi, my name is Betty Brown, and I think that when it comes to youth, because we work with a lot of African-American youth, especially those who are underserved, I'm just wondering, have you guys done anything to affect the gang violence in the African-American community? That is, a lot of our youth are being affected by that, and some of our youth are not even coming out of their homes. Yeah. And that's a huge issue. So can you address that at all?
I actually don't know the work that's being done on if that's being done on our unit. And so I think I saw, not to put you on the spot, but if Kate knows if you're still on the call.
Hi. So hi everyone. I'm Kate O'Donnell. I can turn on my camera.
I'm going to put you on the spot. I don't
know.
No,
It's okay. I'm glad I'm here. I don't really have anything else to add. So Kate O'Donnell, she, her pronouns. I'm the School-Based Health Center Program Coordinator and Adolescent School Health Unit. I'm a white woman with red glasses and short brown hair. So we fund school-based health centers. For example, Multnomah County, they have, I think, around 10 school-based health centers, and they also do some youth-led programming locally that we help support. I think some of that work has been tied in the past to work that the Multnomah Youth Commission has done, and I think those folks at the local level have been doing some kind of gang violence reduction prevention programmatic work, but it's not something that we have necessarily directed funding specifically towards, but folks may be doing that work with the support of our funding at the local level. I don't know if that answers your question completely, but I would say, like, from our state perspective, like, not necessarily, but locally people may be doing that work with the support of our funding.
This is Jianqing Huang. I'm from Clatsop County, and I'm new to the position. And I have one question. And your youth advocacy group, and have you combined your activity with school existing curriculums?
We are in conversation with the Oregon Department of Education. We haven't specifically combined it with curriculum, but we partner with them and try not to overlap what we're doing, and to make sure that they know all the information that we're gathering, and just to be in partnership, but not specifically with curriculum. But the school-based health centers are embedded in schools, and so are part of the school community.
Thank you.
Lev, you have a question in the chat. Can CBOs who engage youth currently apply for funding through this program?
We don't have funding currently. It may be that the Youth Advisory Council decides to use the money to fund more community-based organizations, and then we can make sure that we get this list of folks who have been coming to these meetings and send that out. But we hope to do this every year, so we can make sure to let you know when there are funding opportunities.
Ilana, do you want to move into?
Yeah,
Oh, it looks like
yeah,
there's.
I think we can do that. There's a couple other comments. One just about the state making more efforts to have school-based health centers in every county, and concerns about access there. And programs for youth 12 to 17 are scarce and difficult to find programs that work with this age group. A couple of comments there. I think we'll go into breakout rooms. I want to just do another mention if there's anyone from Multnomah County or the metro area who has any more information and might be able to respond to Betty's question. I think we want to be able to follow up there in some way at some point if that doesn't happen during this meeting. So I just want to put that out there if anyone wants to provide any more information, either after when we come back together or in a different way. So.
Thank you so much. Yeah, because I think that youth violence it's a problem, and we have youth that can't leave their homes. Their mental health is shot. Their families' mental health is shot because of the fear that's out there. And I think it's a community health issue to a certain extent. So thank you.
Yeah. Okay, Sarah, if you can put us into breakout rooms, we don't have enough OHA staff to be in every single breakout room, but we do want to get your feedback so that we can get it back to the program. So if you don't have somebody from OHA in your breakout room and you're open to taking a note or just, writing down something that you want OHA to know, or you want communicated to someone else or another group who's in this call, you can, if you can write that down and send it to me or drop it in the chat, or you can send it to Sarah Boudreau. We'll provide an email address as well to our modernization, how you can do that as well, or you can write to us directly. Okay, Sarah, shall we? Well, how about 15 minutes or so? Okay.
That sounds great. Room should be opening up now.
Okay, see you back here in a few. All right, welcome back, everybody. Hopefully you had nice conversations. I had a nice conversation in my group, some good ideas and thoughts, requests. Just open it up and feel free to share what you talked about or things that are on your mind right now, or if you have any other questions. We'll do that for a few. We have some time, so looking forward to hearing and can certainly take any questions that we do not know the answers to and go find them for you. So
hi, my name is Laura Vinces. Can you hear me? Okay, thank you. I'm a community support group that connects services with necessities. And we really noticed that we were in trouble. We need their help, and we need professionals who will help us to take care of the youth. And this is problem that have been happening for a long time already. And the pandemic situation we went through is just aggravated the difficulty that we have. So who is going to help us to take care of the youth? The youth is going to become adults. And all these emotional and mental difficulties are not being taken care of. We're going to be dealing with more severe difficulties. We already have a difficult with a lot of people turning to substance use to cope with those difficulties. So what's going to happen after, if we don't take care of all these difficulties? So this is prevention to that happen. So just take care of the youth now to avoid this becomes a huge problem later on. So how we want to do that? How we can contribute and get the resources and people, train people, help them to to get certified. To I don't know, but this is something that I see every day, and the work that we do. And I think this is something that has to be done because this is going to be a huge problem. We have a problem already. We can see our city, how it's transforming, do it to the people that have mental health difficulties. How this happen, the lack of resources, the lack of programs, how we can help to prevent that this become more difficult issues in every city, not just in the Portland metro area, it's everywhere. So how we can help, how we can put people there to help us to do something with this difficulties. A program that we can call, hey, I have a 14 years old with mental health difficult with substance abuse disorder, and be able to refer them a program that they can be helped, that they can get the help that they need to avoid, future damage, personally, also in the community and the family level. Thank you.
I'm happy to provide a little summary of what our group kind of touched on. Common thread was we would love support in the form of grant funding, and that grant funding to be consistent over more than just a 1 or 2 year period, so we don't start something up that's helpful and then it disappears or gets phased down. Also, something that came up consistently was support for training youth and support for organizations to train youth to be able to communicate and advocate for themselves and navigate all the different things that youth have to navigate, along with more volunteer opportunities for youth through CBOs. And just want to make sure I don't miss any. Oh, and then interventions and support in developing interventions specific to queer and trans youth, and also navigating the whole process of consent and navigating providing services to youths, and while not disclosing personal information to a household that may not be hospitable to them.
In response to the comment in the chat of counties needing assistance with getting providers for SDHC, both medical and mental health in the most rural parts of Oregon, absolutely. And part of the COVID funds are being used to support SDHC school-based health centers to provide incentives and higher wages so that we can get folks in rural areas and school-based health centers can be more competitive in the job market. But yeah, the workforce is really struggling right now for many reasons. and many of them are very, systemic. And so that is, it's true. We need more assistance in rural areas.
Anything else to share? And again, feel free to follow up with us. Let's see. Lev, I feel like, did you put an email address specifically about?
I can put that in the chat. And I also want to say that the standards for the school-based health centers, the review is coming up in the next 18 months. We're going to be doing that, and questions that have come up and comments about what school-based health centers should focus on and what they should look like. We're gonna be doing outreach to community-based organizations, to local public health agencies, to youth. And so I will make sure to let Alana and Sarah know when that is happening. And hopefully there'll be, there will be some funding attached to that. And so that we can continue to make school-based health centers reflect what people want. And so we will let you all know when that is happening.
Cool, thanks. Okay, so if you can drop that in the chat, and then Sarah, do you mind dropping our policy or our modernization? Oh, hold on, I can drop it in there. I'm just pulling it up right now into the chat if people, and we'll put this in the chat or in the email that we send out following up with the recording and the actual slides. So one other thing, for those of you who attend regularly, you probably noticed that Dolly England is not here as our usual amazing facilitator. We this meeting now conflicts with some work for the community engagement team. So we are thinking about looking at changing the, it would still be every month, but thinking about changing the day to make sure that community engagement staff can be here, that you work with regularly. And so we're thinking about it. We're going to keep it monthly as you requested. Might not manage next month, but in the next few months, we're going to get this changed and try and bring everyone back together. So look out for that. And other than that, I just want to say thank you to everyone for coming, for telling us stuff, and I hope you'll continue to do that. Thanks, Lev, for providing information about the adolescent and school-based health unit, and looking forward to seeing you next month. Thanks so much, everybody. Have a good afternoon. Bye-bye.